Now broadcasting on Star Worldwide Networks, it's Healthy Senior Living with Smiles by Delivery. Healthy Senior Living explores all aspects of creating a happy and healthy senior lifestyle. As the premier mobile dental practice in Arizona, we have mastered the art of delivering the highest quality dental services in our patients' homes. This show will bring you an engaging and ongoing discussion with the leading voices in the field about the best options and strategies available to help seniors live healthy and comfortable lives. And now it's time for Healthy Senior Living with Smiles by Delivery.
Welcome to Healthy Senior Living with Smiles by Delivery. My name is Michelle Trent, and I'm here to be a co-host for you today to get through this show. Along with me, of course, is my ever-steady Roger.
Hi.
Hi. So glad to have you here, Roger. As we
Thank
have
you.
Another show, which is really designed as a resource for our guests. That's
Yes,
what we always do, right?
Exactly. And you know, the thing is, there are so many aspects of healthcare. Mm-hmm. Even if you're, my age, in other words, you're a senior, there are things that you've never considered due to age, and you're only now learning about them because you have that problem. So that's why it's always great to have guests on this show who can talk to us about not only the issues involved, but in this case, sort of how you can best be, your health can best be managed by a group that has a lot of different people.
Right, managed by a group that has a lot of different people, so you have even more resources available at your access, and also just the convenience. I know that's something that comes up a lot. Smiles by Delivery, of course, being a part of the show, and Smiles by Delivery is the premier house call dentistry in the Valley, and they provide a tremendous service for residents who are unable to get to providers, or maybe it's just incredibly inconvenient to get to providers. And that's why we're very excited about the guest that we have with us today. His name is Joseph Wieleba, and he is the Director of Operations for Sun Valley Health Call and Surprise Health Center. So welcome to our show. Joseph, we're very happy to have you here.
Well, thank you, Michelle and Roger. It's a pleasure to be here today.
And please go ahead and just tell us a little bit about yourself and also your role with this particular healthcare facility.
I've been in the healthcare industry going on 14 years now. I started off in the payer side of the house, working for the insurance payer side, and made a transition over into the provider side. And one of the biggest reasons for me moving that way was what they offer. And exactly, Smiles by Delivery, they bring in a great service. It's mobile service to patients who have difficulty getting out to the dentist to have the service that they need. Well, what we do at Sun Valley House Call is the same thing, except we do it from the medical side of the house. We're a group of primary care physicians with specialty in wound and podiatry, and we can go out and we can help that patient population who has that taxing effort to get out to go see those folks. And obviously we know the importance of preventative maintenance and preventative health care to be able to continue our well-being, and that's where really what we do and where we step in is to help those folks and that population who does have a taxing effort to be able to get out there. And we cover it throughout the entire valley here. Besides house calls, we also do the traditional clinic business as well. But we really focus on that house call piece because of the need that's there. One of those crazy stats: there's 11,000 Americans every day who turn 65 years old. Mm-hmm. We are in the midst of seeing that baby boomer population, coming in, and hence why you see, every corner there's competing Walgreens adjacent to one another, CVS's, all of the pharmacies, because we realize that this is something that, we as a nation, we have to be there for our seniors and be able to provide the care that they need.
What kind of operational challenges are in a group that does a lot of mobile home visits? What are some of those operational challenges?
That's a really good question, and things that you see is with folks being immobile or bedbound even, or they're in memory care facilities. The biggest challenge, the biggest part is them getting out. So even if you need to get blood work done for them, if they need an x-ray or like basic ultrasounds that need to get done, what we could do is through partners that we have in the industry, we could help bring those services to where they are. Patients too, even the difficulty that comes to the family. It may be yourself, myself, that loved one who may have to take time off of work to go and get those patients or their loved ones to their appointments. And then we all know you go into a doctor's office. Very rarely do you ever get in at the time your appointment's ever scheduled. There's always usually some wait time that goes in, and that makes it difficult for folks in their everyday life. So it's a challenge, getting all of the services to the patients that we have in there. But with what we have, and also too, is even other organizations that are out there. The mobile dentistry group with Smiles, that's another great. We also work with other mobile groups that are there. Mobile optometry groups that can come in now and help us take care of that overall care. But it's still, like I said, it's mobile, and it does challenge because you can't get everything. It's difficult to get cardiologists there or a neurologist if you need to, or even an endocrinologist. Any of those, it's still challenging. But so that's why what we do is we've expanded out. Besides primary care, we're also doing podiatry. We do wound care. We're looking at psychology as well to be able to bring those services to the patients in need.
So I'm just trying to make sure that I understand this. So you're saying the primary care is something that you can deliver in home, but when it gets to some of those specialty disciplines, that's something that they're not able to.
Exactly, because it just, the field hasn't evolved yet. With the specialist, there's such a demand for them, and so it hasn't evolved yet where they can move into that house call realm. So it's very challenging for them to get out and get those services that they need. Hopefully, like I said, the way things are moving in the next, 5-10 years, you'll see more of those specialties. Obviously, the telemedicine starting to come into play. That's becoming more and more, popular. That's out there, and it's helping those particular types of needs get to the patients. But currently, you don't see a lot of that, and that's one of the things that we come in from a challenge is, as a primary care physician group out there, is if you do have patients that need those, more times than not, they'll go without that service just because they don't have the means to get there and then, get back again.
Well, healthcare is changing, obviously. It's difficult to convince the older specialists to do, home healthcare because they're pretty much, locked into their routine of going to the office and seeing patients there. But with younger ones, I would presume they could be easily convinced, I think, that mobile home care could be something in their future. But in the meantime, telehealth seems to be, or telemedicine seems to be, the bridge to that, because then the doctor stays in his office and you see the patient remotely and can see and treat them that way.
Yep. Well, exactly, and that's where we're seeing a lot of advancements in the industry and starting to utilize that. Smiles is another great example. They're bringing that mobile dentistry, that telehealth medicine aspect into what they're doing. There's more and more practices that are starting to expand in that, even into the younger population, the millennials, the 18 to 29-year-old population. 40% of those folks, they don't even have a PCP anymore. Why? Because it's not convenient for them. It's easier for them to walk into an urgent care, open up your smartphone, pull up, do a telemedicine, just connect into a provider there. So there's really that transition that's going there, and I think it'll help a lot from our healthcare industry and as a whole, is giving that added to the specialty side of the house.
What might someone expect if they walk into Surprise Health Center and they are looking for, they're new to the Valley and they come in there? What kind of care can they expect, and what range of services, I guess, are you able to provide for them?
Yep. What we do, we're family owned and operated. We treat every person who comes into our clinic or part of our house call group as one of our own family members. Dr. Ankar Bora started the practice some 30 years ago. So when someone comes in, you get treated like you're a family. You're a family member. And we can handle everything, from, like I said, our primary care needs to podiatry needs to the wound care needs to even coordinating their care that they have with specialists. We are part of an accredited care organization. It's Connected Community through ASPA, which that opens up our network as well too, is being able to coordinate care amongst the specialties, but also doing it at a cost-efficient way, so that our members then aren't being overly priced or having to pay more out of pocket for services that they're in need of, but may not be able to afford.
Unlike the past, when we had doctors in solo practices, and you went to see the primary care doctor, and then if you needed to see a specialist, he'd be on the other side of town. Somewhere inconvenient. This isn't the way normally it should be. They should be grouped together, and that's what your situation is, right?
Yep.
The specialists are with the primary care physician.
Exactly, and that's the intent of what we try to do. As obviously as when you're working with patients, you want to be cognitive of what their insurance is, what their benefits are that do get covered, their location, their ability to be able to transport or move. So we definitely work from within that, and that's part of what our network is we take all of those into consideration before we're putting them in or referring them into one of those other specialties, so that it's the most convenient for them with the least amount of hassle that they may have to do with, whether, like I said, it's from their insurance and how they pay that to the location to where they reside. That's really one of the services that we'll help provide, and what our staff does is to make that as easy as possible for our patient base. And not only our patients, but our loved ones, the folks who are also helping care for our patients. Because like I said, that takes a lot of effort out of a lot of them, as well as a lot of time in their day, to be able to transport or to help and move those family members around.
Obviously, insurance plays a big role in people being able to afford health care. And are there limitations to the insurance providers that your practice will accept?
Limitations to what our practice? We're pretty much, for the most part, we're contracted with just about everybody who's out there.
Okay.
And part of that has to do with the longevity of our practice too, and the history of what our providers have. And we've got a really good staff that goes out and gets those individuals credentialed. So anybody who works within our practice, they'll know on the front end, what exactly, if they have anything out of pocket, what that would be. If they don't have anything out of pocket, they're going to understand and know that. And we also work with them too, because we realize, folks are in different situations. And so folks may live on fixed incomes. They may not have, all of the coverage that they would love to have. So we work with those individuals too, so that they can get the best care possible for them, and patients don't go untreated.
And if someone has Medicare or Medicaid, that's something that you can work with?
Oh, yeah. Yeah, we're Medicare, Medicaid. Those are two of the biggest payers that we work with. We're contracted with pretty much all of the major commercial insurances that are out there. So, there's not too much that we don't work with. So it gives a lot of options to our patient base then as well.
The three words that you never want to hear if you're a patient is out of network.
Oh, yeah.
So right. That's obviously what you prevent by having a group.
Yeah, exactly. That's the whole premise behind that, is keeping people within that network so that there's a great continuity of care. We could share amongst each other. Referrals and work gets done. It's expedited. You don't have to wait a long time. And then, like I said, the biggest part is just that communication then that happens between the various professionals that are there, so that we're all working towards the best possible care plan or plan of care for those individuals and those patients, so that they get the best care they need.
Joseph Wieleba is our guest on this edition of Healthy Senior Living with Smiles by Delivery. When we come back from our break, I want to ask Joseph about medical records, which is an interesting topic to pursue. And Michelle and I will be back in just a moment.
Healthy Senior Living will be back right after this.
Sun Valley House Call is a network of fully licensed and credentialed physicians,
specialists, nurse practitioners, and physician assistants that provide medical services to residents at home. Their team utilizes innovative equipment, best practices, and an advanced electronic medical record system to provide the best care leading to the best patient outcomes. Sun Valley House Call brings the doctor to the patient in assisted, independent, group home, and memory care communities. Working in partnership with laboratories, medical services, and pharmacies, Sun Valley House Call brings comprehensive on-site coordinated care to the residents, alleviating the stress and hassle of transportation and wait time issues often involved with doctor visits. Sun Valley House Call practitioners service patients who are homebound and require physician visits to provide ongoing care. SVHC delivers a comprehensive range of medical, diagnostic, and consultative services in addition to patient care coordination between families, nursing agencies, and home health services. To find out more about these services, please call 623-934-1245 or visit us at sv-hc.com.
This is Healthy Senior Living, and we're all interested in health and healthcare. You listen to this program and probably frequent other sites on the internet for health information. But until now, you haven't been able to find one website that has it all. One website that links you to the dozens of articles published every day about healthcare. That's why I created My Healthcare Report. You'll find links to the latest articles on diseases, treatments, diet, technology and medicine, research, the business of healthcare, and a lot more at www.myhealthcarereport.com.
Now, back to Healthy Senior Living with Smiles by Delivery.
Welcome back to Healthy Senior Living, where we've been having a discussion with the Director of Operations of Sun Valley House Call Surprise Health Center. And I know right before we went to break, Roger, you had some questions. I'm
Yes,
going
I
to turn
do.
right over to you.
Well,
I knew you would.
medical records are really important. In other words, knowing what you've had or done in the past is very important to the provider who is seeing you today or tomorrow. So the question normally is, where are my healthcare records? But when you have when somebody at a group is seeing you, that's not an issue.
Correct. That obviously today's day and age, technology, electronic health records have made a drastic improvement in where we used to be in the past from paper charts. And the beauty behind that is it doesn't matter. Like I said, you could be in the hospital, say you had a hospital stay. Maybe you're coming over from another one of the providers within our network, a specialist. All of that stuff is instantaneous. We know that appointment's coming in. It's a simple request that can go out to that other provider, and within less than 24 hours, sometimes same day, you have it. It's in that medical chart. And now those providers have that ability to review through and see, okay, what's happened with, if I'm at my primary care and I want to know what happened with my cardiologist, I have that there. If I've seen the podiatrist, I can easily go back in and say, okay, what's happened with the podiatrist? Behavioral health, I can get those inputs that come in from there. It really makes it a lot easier in today's day and age, and also makes it a little bit more compliant with HIPAA and HIPAA regulations that are out there. You've got to be very careful of people's personal information that happens, and so having those systems and that technology in place has really made it a lot more convenient and able to care for our patients.
And it's really important when we deal with medications, because if one doctor is providing this medication to you, the other doctor may not know that.
Mm-hmm. Well, exactly. And, having that medication reconciliation process in place is very important. It's actually quality measures that, like Medicare, they look on that, and they actually will grade providers on, are they doing that? But also, too, like you said, is just knowing medications, vaccinations, things of that nature. If you get a pneumonia shot, well, your payer is only going to pay for that one time. So if you can't remember, and you turn around and you go into a different provider 4 or 5 years ago, that could be a $200 charge that comes back against you because, the payer says, well, you already had this. So it's very important. And on top of it, too, as we were talking earlier with the technology, is that great word, patient portals. A lot of these electronic health record systems have now created that, and it gives the patient power too to update their medications that they're on, because there are multiple doctors there, and that all goes directly into the electronic health record system. So now that helps educate even the providers to make sure that, hey, everybody is on the same page as to what medications are being administered, which ones are working, what things we need to deactivate or put. So the technology piece really helps a lot with the medical records portion.
Yes. I find this such a relief, because it feels like sometimes when you go into different providers that you're just starting from scratch and you're trying to remember, everything that may have happened to you over the span of your lifetime. And they're asking you, when did you have the surgery and when did you take this? And when I don't know. And this is my symptom today. I have a cold, So what you're saying is you're keeping track, or within your network, you're keeping track of those things for patients. So as they go to different doctors, get different treatments, it's all consolidated.
Correct. Yeah, it's all part of the continuity of care. And like I said, being a part of an ACO like that allows you to work within those other specialties, so that it's a collaborative effort. It's how that network can help manage the overall care of the patients, and they do it more in a cost-effective way, but also to a service to the patient. Because exactly, we all you walk in and here's the old way of doing it. You'd walk into the practice and here's a stack of forms an inch high, and it says,
Right.
"Hey, can you fill out all this going back to the day you were born and remember everything and anything that's ever happened to you?" Well, that information now can get put into the systems, and now it's easier to see it and to visualize it and be able to share that information versus, "Hey, Michelle, can you write all this down on a piece of paper again?" So.
Yeah, and I think when they ask me about medications I'm taking or the quantities or dosage or something, I'm like, 2. I take 2 of the white ones. And apparently that isn't all the information that they're seeking.
No, yeah, and especially with so many different. I mean, watch television. How many commercials do you see for different new drugs that are coming out? And all of them have side effects or adverse effects, and how they interact with one another. And obviously the pharmacy boards do a great job of managing that as well too. The pharmacists are really good at giving back to the primaries, like maybe you shouldn't prescribe that, or in case you didn't know, a patient does have this on their record. So the communication's there, and it continues to get better. And the payers and CMS, they're helping guide and direct those services too, so that everybody works a little closer together.
It's really good news.
I was just going to say, let's say somebody has been a patient at the, I have to look at this because it's complicated, Sun Valley House Call or Surprise Health Center, and then they move away, and the new doctor needs to see all of their health records. How do you provide that to them?
Once we have, obviously due to HIPAA, of course, the patient, when they come in and they're with our practice, we have them sign basically a consent form. It's a medical release form. And all that does is says, hey, if you have another medical professional that you're seeing or going to, it just allows us to do a courtesy and send that directly over. And that's what we do. As soon as we know who that other provider is, say they move out of state or wherever, once we know that provider's contact information, our system, we can send it out within minutes through our system, and that other provider gets it instantaneously.
Just because I know how the system has worked in the past, that is the beauty of electronic health records, because in the past, if you wanted your records, they are kept by the physician. Those are maintained by the physician and are the physician's property, believe it or not, even though those are your health records. So in order to get your health records, you had to pay a fee for them to duplicate them, and then you had to wait a couple of weeks or however long it took them, because there is nobody in that office, dedicated to making copies of those records. So they made them at their convenience, and so you had to wait who knows how long for those records and then pay for them. So this is the beauty of electronic health records.
Oh, without a doubt. And today, it's a matter of just clicks. You've got a person that'll go into the chart and they'll click off, okay, do you want, the last X amount of encounters? Do you want the lab work? Do you want, x-ray results? Click, 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 and basically off it goes. So it makes it very convenient for the patients as well as the other providers in being able to share that information. And that's one of the big parts of medical care today, too, is when you work with so many various specialties, is sharing and communicating that information from one practice to the other, because then it gives us all that same knowledge as the other, so that we can create the best plan of care for those individuals.
Electronic records, that's very important. House calls, that is a great convenience. Look ahead into the future, into your crystal ball, if you will. What can we expect in the next 5 to 10 years as far as advancements in healthcare?
I really see a lot moving towards, as we were talking earlier about, telemedicine, telehealth, to the standpoint of even seeing it in the operating rooms. If you're going to go in and you may have, some sort of injury that comes off, and you go into the emergency room and they need a certain orthopedic specialist. Well, I could see it coming to that point where in the next 5-10 years, where that ER, it might be in the middle of the night, they don't have an orthopedic specialist available. Say maybe they're up in Wickenburg, and they'll turn around and they'll have the capability of to pop up onto a big monitor, connect into a person, and it'll actually be able to guide and give consultation during the type of surgery. That's where I see the healthcare industry really taking a hold of technology, and being able to improve what people do. You see the basic things in preventative care. Look at Apple today. Everybody with the watches, they're going to count how many steps you do, how many calories you do, and what you're going there. And that's just a simple monitoring application that you can wear on your wrist. Technology is taking us to that direction, and that's where I really see in the next 10 years the biggest advancement will be through that telehealth and being able to provide service to anybody, anywhere, at any time.
The real problem with medicine in the future is the amount of information that will be available, and how to not only protect it in the sense of keeping it, accessible, but also how to integrate it into the system. So you're talking about wearables that right now, like Fitbits and the Apple Watch, provide instant information to the patient, but not necessarily to the doctor. And if it does the doctor even see it? And why isn't it in the medical record?
Well, it's a good question, but actually it is. There's a lot of Bluetooth technology that's out there where you could put a blood pressure cuff on and it will measure your blood pressure, and it will upload it into your medical chart, and your doctor can check your blood pressure from you. Glucometers, where you need to check your blood sugar and stuff. All of that stuff, there's so much technology out there today where they could check that, and it actually gets uploaded and goes right into that patient's medical chart. So your providers actually today, it's not super elaborate, but it's building there where there are monitoring devices where that will actually tie directly back to your primary care, and he can see all of that stuff without you ever even walking into an office, and that helps manage that patient's care then, I think a little bit more thoroughly, because now there's certain measures that you may have or want to keep track of, and like I said, as you get older, maybe you have a little memory loss, and so you don't remember to check your blood sugar, or maybe you don't remember to check your blood pressure, on a regular basis. So there is that technology that's actually there that does tie back and integrate directly into your PCPs, into your charts.
So Alexa's not only going to be my DJ, she's also going to be my PA.
You're exactly right. That's the route it's going to. And they're looking into doing, it's actually some of the companies like that, what they're looking at is watching your patterns. What's your lifestyle and your patterns, and monitoring, foods that you're ordering online and are being shipped to you. And they're trying to, see what your lifestyle's like and the things you're doing to actually give you recommendations how to improve, your healthiness of what you're doing. So it's only a matter before exactly where if you have a cold, you're going to maybe take your temperature, Bluetooth into Alexa, and Alexa's going to turn around and tell you what you should go do.
So she's going to rat me out for getting into the Halloween candy early. Is that what you're saying?
All over you. She's already got you.
Well, Joseph Wieleba has been our guest from Sun Valley House Calls and Surprise Health Center. It's been a pleasure, Joseph, because you've provided us with a lot of information that we normally don't talk about when we talk about healthcare, because it's all the back office kind of thing. Tell us again how to reach you or the specialists or the primary care physicians at your center.
Sure. There's 2 ways you can give us a call. It's 623-934-1345, or just going to our website. You can go to www.sv-hc.com.
Okay. Thank you very much for coming today on Healthy Senior Living with Smiles by Delivery. For Michelle Trent, I'm Roger Downey. Thank you.
Thank you for listening to Healthy Senior Living with Smiles by Delivery, the premier mobile dental practice in Arizona. Catch the show live each week at this time or 24/7 anytime on demand on StarWorldWideNetworks.com.